I'm Dr. Juyia, a board-certified gynecologist at Elite Women's Care. Today we're going to talk about genetic cancer screening.
Dr. Juyia, when should I have a breast cancer screening?
Breast cancer screening can start as self-breast exams around age 21 or even earlier, and we call this generally breast familiarity, meaning you should know what's in there and check a few times a year. For women at higher risk, because there's breast cancer in the family, we would recommend starting 10 years younger than the youngest affected member in that family, not to be started before age 25 for breast MRIs or age 30 for mammograms.
When should I have an ovarian cancer screening?
In general, it is recommended to have a yearly or annual wellness exam with your gynecologist, at which time a pelvic exam will be performed, and we can often feel masses of the ovaries with this. However, it's important to know that cervical cancer screening is a pap smear, cannot screen for ovarian cancer. And although this topic has been of utmost study, we still have not found any good screening for ovarian cancer.
When should I have a genetic mutation screening?
People at increased risk for breast cancer, uterine cancer, or ovarian cancer are eligible to be screened for genetic mutations that they can inherit in their DNA from family members. If a family member who is affected by cancer cannot or will not be tested, then it would be important to test that person who is at increased risk. If alternatively there is a family member who has tested positive for a genetic mutation, we can test a family member for exactly that mutation to find out if she carries it.
What symptoms should I report on my wellness visit?
While there's a lot of things to consider at a wellness visit, symptoms that should be reported are a new breast lump, new nipple discharge, difference in skin of your breasts, pelvic heaviness or pain, or anything new with early satiety, which means you're getting full earlier, especially important for older women because ovarian cancer has not very obvious symptoms. It's relatively uncommon and it happens in older women generally, meaning over age 50. Also, I would want to know about any irregular bleeding, especially any bleeding at all in a woman who's done with her menopause.
What mutations put me in a higher risk category?
There are actually a lot of known mutations now that are associated with an increased risk of cancer. Some of these cancers run together even, so we screen everyone for a family history of breast cancer, ovarian cancer, uterine cancer. But other cancers are to be considered as well, such as pancreatic or prostate cancer. The genes and the genetic mutations for this are numerous, but something everyone, or at least most people, have heard of as the BRCA mutations. To learn more about our practice or talk more about your cancer risk, please contact our office either by phone or Facebook.